everyone. I can see we have a few people already joining us. We will get started in another minute or so. So sit tight and I will see you soon. All right, we're going to go ahead and get started. Hi, everyone. Welcome. I am Morgan Zients. I'm the Senior Product Education Manager here at Jotform. Thank you so much for joining me today for how to leverage technology to meet the rising demands for healthcare. In today's session, we will be talking about some of the challenges that healthcare providers are facing in 2025 and how you can meet those challenges with ease with the help of technology. Before we dive into it, I have our agenda and some quick housekeeping for today's session. So we'll be discussing some common challenges that healthcare providers face, and we'll look at some solutions like automation, increasing access to care, and leveraging AI. We will also check out some testimonials and statistics from healthcare providers, much like yourselves. Please feel free to share questions at any time. So after the slides, we'll have a demo and we'll have live questions. I do also have my colleague James on the line with us today answering questions behind the scenes. So feel free to share your questions as they come up and we will be able to respond to you as they come in. You can enter questions under where you're seeing the slides currently. On the right-hand side of the console, if at any point today you would like more information about Jotform Enterprise, you can reach out to our enterprise team just by clicking the send button. And then underneath where you're seeing me on the left, you will also see resources related to today's session. I'll talk about those a little bit later before we close things out. Feel free to do any of that throughout the session. You can also minimize or maximize or move boxes around so you can focus on whatever it is that you need to focus on today without affecting anybody else's experience. Okay, so first things first, for those of you who are not familiar with Jotform Enterprise, I wanted to start by introducing you to who we are. Jotform Enterprise is a digital transformation platform that helps healthcare providers tackle all of the challenges in modern healthcare. From new patient intake to securely storing and sharing patient records, Jotform Enterprise has you covered. That includes HIPAA and SOC 2 compliance features, a local data residency option, and account roles and monitoring, all to help keep data safe and make sure that you are abiding by any compliance regulations. And now diving into the topic at hand today. As healthcare providers, I'm sure that you deal with a lot of ups and downs on a daily basis. The healthcare sector is no stranger to uncertainty, from pandemics and emergent diseases to aging populations and staff shortages. Healthcare workers adapt daily to daunting challenges, perhaps more than any other industry. Of course, I don't have to tell you that issues like decreased funding, increased administrative complexities, data security, and a disconnected tech stack or outdated tech stack might be issues at the top of mind for healthcare providers today. Considering political and economic uncertainty in the world right now, those issues might become even bigger problems over the next few years. And while unfortunately I can't predict the future, my goal here today is to help you prepare for these challenges so that they can feel a little bit less daunting as they occur. One of the best things that you can do to prepare for these challenges is to leverage technology and to be willing and able to adapt. I know that sounds really broad because, of course, everybody is using technology to provide care in some capacity, but there are a lot of solutions on the market and a lot of different things you can be doing. So I'm going to be sharing some testimonials and solutions from providers just like you in just a moment. But before I share those, I wanted to start with a quick poll here. And I'm looking for information generally about how much time you spend doing manual tasks, administrative work per week. So I'm going to launch that poll now. I'll give you a couple of seconds to respond. And then if that box doesn't close automatically, there is a little X that you can use to close it when you're done. So we have 0 to 10 hours, 11 to 20, 21 to 30, or 31 or more hours per week on manual tasks. All right, I'll give you another couple seconds, and then I'm going to switch over to those results. Okay, so it looks like most of you answered between 0 and 10. Hopefully that is on the lower end of that range as well. So that's great to see. I know that that number can really vary from practice to practice and practitioner to practitioner across the board. I believe on average, I have a statistic a little bit later in the slides, but on average, it's about 8 hours per week. So that's great that you are right in that target. If you are doing anything more than 0 hours per week, you might be interested in learning more about Rhinogram. Rhinogram estimates that automating paperwork and processes has saved 3,000 hours of patient and provider work each month. Rhinogram delivers telehealth solutions to healthcare providers, and it relies on Jotform Enterprise to provide form solutions to its customers. One of the reasons that Rhinogram uses Enterprise so heavily is because Enterprise has a number of automation and integration features and a lot of power in that respect. If a patient doesn't complete a form or fills it out incorrectly, Jotform will automatically nudge patients to update their forms, so providers or administrative staff don't have to worry about that. Rhinogram also automates appointment reminders and notifications, allowing providers to set the cadence for how often and what they want to say in those reminders. So in that respect as well, there's no need for manual data entry or manual follow-up with patients. And of course, using tools that can properly integrate with each other is very important to a lot of providers. Rhinogram integrates Jotform with the provider's electronic health record system so that patient data is securely and automatically entered into the provider system from the Jotform forms that is the data source. This saves a lot of time and effort from somebody who would have to otherwise manually enter that information otherwise. And it reduces opportunity for human error. Anytime somebody is physically inputting data, is it a chance for there to be mistakes along the way? So we're reducing human error in that respect. Another way to save money, reduce strain on healthcare providers, and provide tangible results is to consider using more self-service and automation options. International vision care nonprofit UXI, for example, devised a system with Jotform Enterprise's conditional logic that guides field workers through vision testing. That means that vision tests can be done without the presence of an UXI employee and in a way that winds up being far less complicated and cumbersome than what they were doing previously, which was following a very lengthy instruction manual. Automating this process with a dynamic instructional form relieved the strain on providers to perform fittings, which has saved time and money for the organization, but it's also really expanded the number of people that they can serve throughout the world. They are able to distribute even more glasses, again, serve more people. And again, they're doing that by also while saving some time and money along the way. Another great way to provide self-service options is to use patient portals and apps. Portals can be a really excellent way to keep forms and other resources for patients in a singular place. They can increase communication between patients and providers as well. In fact, 73%, so nearly 3/4 of physicians that use patient portals, portal apps, whatever, say that this has made it easier for them to communicate with patients. Providing these self-service options like this and others can definitely be a solution to simplify your workload. Another solution might be to simplify your tech stack. And I am going to share an example about that as well, but I had another poll here. I wanted to see from the audience here if you have any other challenges that might come into play with technology. So we'll go ahead and launch that poll. And once again, I'll give you a couple of seconds to respond here. And again, if that box doesn't close automatically, there is a little X that you can hit for that. So do you maybe have too many platforms? Are you seeing a lack of integration, poor user experience, either for patients or staff or both, outdated platforms, or platforms that you find are very expensive? And I'll give you another couple seconds for that. Okay. Okay, so lack of integration coming up a lot, outdated and lacking key features, cost, a big one. Yeah, so technology is so useful for so many things, and it's such a part of everything we do. But obviously, there can be issues with technology, and these are some of the ones that we've heard about most commonly. And I do see, of course, that you all are experiencing some of that as well. So we have talked about different ways that tech tools can help you provide better care. But again, paring down the number of tools that you're using might be another strategy that you can lean on to help provide better care and remove barriers to information. For example, Body Brave, an eating disorder treatment center based in Ontario, Canada, added Jotform Enterprise to its tech stack. And after they did that, they realized that they were able to remove several other platforms. So they were able to go from 5 platforms down to 1. Paring down the platforms made the program evaluation officer and the program coordinator's jobs much easier. In fact, consolidating the platforms saved Body Brave over 120 hours of work in the first 6 months of use. And they're also saving over 5 hours ongoing on a weekly basis. This is a small nonprofit, so being able to get back almost 1 full employee day per week has been incredibly valuable to them. And also they're able to more focus on patient care and providing the best care and the most time that they can with their patients. Okay, so the last thing I want to talk about is AI. And before we do that, final poll here. So are you using AI in your administrative work or anywhere in your practice currently? So we have that poll. This is a quick yes or no. So I will just give you a few seconds here. All right. Let me go back to that. Okay. All right. So 100% of people responding said that you're not currently using AI. This might be a good opportunity to consider what some of your options are. That's good to hear, good to gauge where we're at. And again, there are a lot of different AI tools that can really help with patients and help with providing service and help you tackle some of your healthcare hurdles. On average, just like I talked about in the last example with Body Brave, and I mentioned earlier, healthcare providers are spending 1 full day of work per week just on administrative tasks. Imagine what you could do with that time back. AI can help you with that by helping you complete administrative tasks and also serving as sort of frontline patient support. There are many AI agents out there, but Jotform AI Agents is probably the one I'm most qualified to talk about. And I will actually show this in our demo as well. Jotform AI agents can be trained to answer patient questions, schedule appointments, even process payments. You can train AI agents on healthcare coding databases to save you the time of having to look up billing codes. Training agents to do simple administrative tasks like these allows you to focus more on quality in-person interactions and more complex patient concerns that might come up. Again, you can train your AI agent to be that frontline support, to have FAQs so that patients don't have to call into an office to ask certain questions and can save up more time for everybody within your practice. AI agents can be trained with links, PDFs, forms, predefined actions, and chats. They are also available in quite a few different channels, so you're bound to find one that works for you. And again, I'm going to show that off in just a couple of minutes, but on that note, it is time for us to go out into our demo. So I'm going to go ahead and share my screen, and we'll go out into Jotform. Okay. All right, so you should be seeing my Jotform account now. So 3 things that I want to show here. 2 are things that I talked about very specifically in the slides, and then I also want to talk a little bit about some of the administrative oversight that you have in Jotform Enterprise. So I will show you how you can very quickly and easily build a patient portal, patient app, and I will also show you how you can get up and running very quickly with an AI agent to do some of that administrative work or answer be frontline support for your practice. And then lastly, we'll look at the admin console. I am starting the demo here logged into my Jotform Enterprise account, and I'm on my workspace. This is where I can access my own forms or any other assets I've created within the system, and I can create any new assets from here as well. In addition to my own personal workspace in Jotform Enterprise, you have the capability of setting up teams for any group of people that might need to collaborate together. So while currently we're looking at my own individual things, we could switch to looking at one of my teams and see some shared resources, shared forms, other assets, data, et cetera, for those teams. I'll show you what that looks like in a little bit. In addition to that, we have some organizational options here on the sidebar. Search over here, any of your settings and the admin console that I mentioned are under your avatar in the upper right. And when it is time for you to create anything, you can look for that orange create button and select what it is that you want to create. So I will start with an app. You'll see when I click on app, we have a number of ways to get started, including building from scratch. In this case, I'm going to use a template. Templates are a really easy way to get started very quickly. They have already been built for you. You can still customize them as much as you need. So you can really make it your own, even though you're starting with a template. We have over 800 templates available. You can search or browse. You can also browse by type of app. So let's click on healthcare here. Now we see a number of different healthcare apps, and I can scroll through looking for one that seems like it's relevant to what I want to do. So let's say I want to create a medical appointments app. So this would be something maybe for our newest patients or maybe even new and returning patients. We have one right here. I can hover over it to preview it. I can also click this button to view it in a little bit more depth before I use it. And I can hit use template to go ahead and clone a copy of that template in my account. From here we're seeing the cloned copy of this app. I can change it and edit it, customize it however I need. That's not going to affect the original template. It's only going to affect this version. Here in the app, we have the clinic name and a logo up here. You can change any of that by clicking on it. So you can change the logo, change colors, etc. All of the design options are with the app designer on the right, and elements, any of the content is coming from here on the left. What we have here are 2 forms that have been pulled in. These are part of the template. If you are using an app template, it will also clone a copy of these forms. You can use these forms and edit those however you need, or you can delete them and add in your own forms. You can customize anything here. There is a paragraph of information about the practice. We have a map. We have some contact buttons that are going directly to a phone and email, and then some social media icons at the bottom. With regards to design, if you click on that app designer button, you can remove the background image and replace it, change color schemes. There are also app layouts as well. So if this layout doesn't seem like a good fit for your patients, you can change that layout and again, play around with it from there. And then again, on the left, we have all of the elements that you can pull into the app. So for example, if you already have a medical appointment form, you don't want to use this one, you have one that's already got a bunch of data on it, you're maintaining records from there, you can click on this to delete it. And then you can come to form, drag and drop that element onto the page wherever you want it, select the form that you want to include and hit add, and there you have a form added. In addition to that and anything else that you're seeing already on the page, you have headings that you can add. You can add signed documents. I know medical practices often have like a release of information signature needed. that sort of thing, or a consent to provide care. That could be a signed document that you drag in. Other documents, links maybe to your website. This is the button that we see at the bottom. We also have, you can add an image gallery. Maybe you're a dental practice and you want to show off some of the smiles you've created, any videos, maps, your social media options, and more. And then under widgets, you have even more options of what you can do here. If you are sticking with the forms that are already in here, or with regards to pretty much anything already in here, you can click on that to find a delete if you want to remove that, or properties if you want to change that element specifically. So for example, this medical history form is the one that came with this app. I can hit edit form to go out into the form, change it however I need. Again, that includes design as well as elements. And you can click on any elements to customize or remove them. And then again, you can use this as your own. All right, so that is a very quick and easy way to get up and running with an app. Again, these can be very useful for providing information to patients all in one place, and also maybe serving as sort of a frontline support. Patients have this, they don't have to call in asking for your address with the map here. They also know how to get in touch with you for more complex questions that they might have. So this can be a really useful thing to incorporate into your practice, maybe as something that you link on your website. In fact, if you go to publish, this is where you have all of your sharing options. So maybe this is a link that you email out to all of your patients securely, hopefully as well. You can even invite by email as well. You can share with a QR code. So maybe you paste it on the throughout your office for patients to be able to access next time. And you have embed codes as well. Okay, so that covers the app builder. I just hit that Jotform logo to go back to my landing page. So whatever your logo is in the upper left-hand corner, that's going to take you back to the last landing page you were on. And you can see now that I've added that medical appointment app and those two forms that came along with it. If I want to move these to one of my teams, again, currently they're in my personal workspace. If I think, oh, yeah, right, everybody should have access to this. We have a team for the whole organization, the whole practice. I can go ahead and click on the app and click move to team, select the medical team and move it over. When I confirm that, we're going to see all of those get grayed out. They will get removed from my personal space here, and they will go over to the medical team. If I click on the medical team now, we see that app and the forms over here. So again, anybody who is a part of this team now has access to be able to share those, to see data from those. There are also different levels of access you can provide to people if somebody shouldn't have access to data. Okay, I'm going to go back to, let's go back to my workspace here. And once again, I'm going to hit the create button, and now we'll look at creating an AI agent. So I'll click on AI agent. Again, we have multiple different ways to get started. So you can start from scratch and build from the ground up. If you have a form that you specifically want the agent to guide people through, you can start with that form. Or again, we have template options. And actually in this case, health and wellness AI agents are the first item on the list. So once again, we can click on that to browse agents in this category specifically, and hover over to preview, or click on the preview button to get a better sense of what that AI agent does. If we want to use the agent, we can click use agent. And again, that's going to clone a copy of this agent into my account where I can customize it however I need. In this case, once again, any design changes over here, that includes being able to customize the avatar, lots of different options, including being able to upload your own image if you'd like. You can also customize colors and style overall. Over here, I mentioned earlier that there are a number of channels that you can put your AI agent on or offer your AI agent on, so you can get a sense of what those look like by clicking on any of them. That includes voice, phone, SMS, as well as a chatbot that you can embed into your practice's site, or a standalone agent as well. To share your agent across any of those platforms, you'll find that on the Publish tab with various options for each of those. But perhaps most importantly, you will train your agent and give your agent any information it needs to work with either patients or help you on administrative tasks here on the Train tab. Like with apps, this is coming with some knowledge already embedded. You know, in apps, we got the forms that were related to that app. Here, we're getting some knowledge already added. In this case, it looks like sort of some FAQs for the practice. What sort of information do I need to bring? How do I update insurance, et cetera? It's got some standard answers, but you can edit any of these just by hovering over and looking for the green button, make your changes and save it, and then it will be updated with your knowledge. You can also add new knowledge, either text with a PDF or another file that you want to upload with a website, so maybe your website, and by giving the agent specific questions and the specific answers to those questions. You can view all of the knowledge here, and you can, again, you can edit or change any of that. If you want to remove anything, there is also a delete option. In addition to that, you can customize sort of how your agent speaks under AI persona. In actions, you can set up some conditional logic elements. So you can say something like, when a patient asks about making an appointment, when user asks about, and then an appointment, in that case, we want to share, to send them to the appointment scheduling form. So that would be fill form, and then you select the form that you want to share. Under tools, you have a number of ways that you can integrate your agent with other platforms with regards to sharing data or taking notes or setting appointments. For example, those appointment features are probably very helpful in the case of medical practices. And then under forms, you can see any forms that are set up to integrate with this agent. So again, this has created a new patient registration form along with the agent that we can use. We can also remove that and add in whatever additional forms we'd like. All right, so that covers the AI agent builder as well. The last thing I want to talk about is that admin dashboard. So switching gears a little bit here. So we looked at a couple of different ways that, a couple of different tools that we have in Jotform that can help you interact with patients and save your practice some administrative burden. The last thing is the admin console, which can help you make sure that data is being kept safe. Data is very safe within Jotform, but also the people using the data, you can have people using, creating forms or creating other assets that maybe you're not sure about the purpose of that. If you ever want to keep tabs on any of that, you can do that from the admin console. I'm not going to go through all of this. You can see there are a number of tabs here. I also want to point out that we are in the process of rolling out a new version of the admin console. So you can see I have the option to switch here. If any of you are not Jotform Enterprise users and become an Enterprise user, I believe you'll be onboarded with that new console. All that to say, I'm going to use the old version, but all of the information is still available to you. So I do want to highlight some of the particular different ways that you can keep tabs on what's going on with the account. First is users. Here you can view all users to your account. You can search through them. You can add new users right here. And you can also edit any user. So I do that by the three-dot menu to the right of the user's name, where I can change their name, email, username, and their title. We also have the option to select user type from here. So when you add a user to your account, you can choose whether they are a user or an admin. User would be somebody who can create forms, create apps, create any assets, view data, et cetera, but they don't have any of this administrative oversight that we're seeing currently. An admin does have that administrative oversight. So you choose what their user type is, and you can save any changes. If you need to lock somebody out of the account, maybe they've left the organization, or maybe they've left their role where they needed to use Jotform Enterprise, you can toggle that on. You can also delete users from here as well. So there's a delete option. In addition to users, you can keep full track of everything that's going on in your enterprise account under activity logs. So here we're seeing a full record of everything that's happened. You can see a number of the things that I just did here, updated medical appointment app, for example. And then we can scroll through and see every action. We can narrow that down by date range. We can also narrow that down by user. So if we want to look at just one user's actions within the account, or we can also narrow it down by type of activity that ranges from administrative things like logging in, if they have two-factor authentication set up, general user management, through assets, so forms creation, form deletion, form updates, app updates, AI agent updates, all of that, through also data. When are they viewing data or reports? So you can see that full list as I scroll through. It's a pretty long list. You can download whatever it is that you want to access here. And then at the top, you have some highlights from the past week. So if you wanted to really hone in on what's been going on in your account for the past week, you can click on any of these to see more information. So now we're just seeing form creation. Under activity logs are system logs. System logs would be anything that the system is doing. So for example, when somebody fills out a form, they get a confirmation email and the system sends that out. So that's what we're seeing here. And again, you can narrow that down by user, date range, etc. And then the last thing I want to highlight here is support. Here you can access the support team. We have special support just for enterprise users. You can schedule time with them. You have a couple of other resources here. And you can view the status of any support tickets that you filed from here as well. All right, so once more, hitting that Jotform logo to go back to my Jotform landings, my personal workspace. So before I go back to slides, just want to recap from the Create button here. You have the option to create all of your assets within Jotform, and that includes apps and AI agents that we looked at. And then over here, you have settings for your personal account, as well as if you are an administrator, you have your admin console from there. All right, let's go. I'm going to stop sharing my screen and let's finish up with slides, and then we can take some time with questions. If you haven't already shared a question, you're welcome to do that at this time. And let me just close this out. So I just want to talk a little bit about the resources that we have here. So the resources that you'll see under me are the case studies that I talked about today. One-to-One Health was featured on the opening slide, and then the rest, Rhinogram, Uxie, and Body Brave, I spoke about. Those are the examples that I shared. So those link you to those case studies. We have a course, Healthcare Digitization and Automation Basics. So if you would like to learn more about what we talked about today and kind of expand on that, that course would take a little bit less than an hour, I believe. I think it's 6 lessons and a quiz. You earn a certification after that, so check that out. And then finally, we have the report 4 ways to digitally transform your healthcare practice. So that also is a deeper dive into a lot of what I talked about here today. So all great resources, and I recommend you check them out. Okay, so lastly, we have some questions here. I'm just going to try to read through, and I know James is has been responding as well. Can this platform be used for home care support, both for clients and employees? Yeah, that would be an excellent case. So I think all of what I showed you today was very focused on the client side, the patient side of things, you know, the AI agent and the app that I created, but you can absolutely use Jotform internally as well. That team workspace is one great way that people can collaborate. And again, you can add as many teams as you need for as many different things that you have going on in your organization. I believe one of the, maybe I have, I'm just seeing if I have any good examples of what that would look like. I don't think I have an example offhand, but those teams can even include things, assets within the team to help the team management, as well as assets that they might be sharing externally. So yes, absolutely. This is a great platform, both for helping you run your organization as well as helping you interact with patients and provide really solid care to all of your patients. Okay, so there's a question about, I think James answered this already, but just to share it with the audience, you have a number of consent forms that people need to complete, and you're sending each by email. Is there a way to combine forms into a digital packet so they don't have to click on each link? I'm not sure if James responded to that or what he responded. I don't see the answer there, but yeah, there are a couple of ways you can do that. One might be an app, so they would still have to click on things, but you just have to send them the one link. You can also set up apps to include a checklist. And that checklist, that checklist can walk people through and help them ensure that they're completing everything that they need to complete from there. And there are a couple of other ways as well. So if you want to talk more about that, you're welcome to get in touch with me. You can reach out to me, Morgan, Morgan, at Jotform. You can also reach out to our enterprise team, jotform.com/enterprise, and they can talk to you more about some options there, but I'd be happy to follow up with you online. I see we do have Michaela, who helped me create this session, is mentioning that there is a case study, Jefferson Healthcare, so this is going back to the first question. The Jefferson Healthcare case study, they are using Jotform Enterprise both for patients and employees. You can find that. I'm not sure if there's a way for me to share that, but if you go to our Jotform blog, so jotform.com/blog, you can search Jefferson Healthcare, and that would be a really relevant example to what you're looking for. Couple more questions here. Can I accept online payments and collect e-signatures? Yeah. So yes, we integrate with a number of different payment platforms. I think we have about 30 different payment platforms. So if you want to be able to schedule appointments and also have people pay for appointments at the same time, all you need to do is, actually, I'll go ahead and share my screen and give you an example of that one. So it's easy to find. In any form, let me go back to my medical team here. If you edit the form to pull it up in the form builder, here's a medical appointment form. Under the add element toolbar for forms, you'll see payments here. So this is where you can add any payment gateway, just drag and drop it where you want it, and then follow the prompts to integrate Jotform with the payment gateway. And yes, you can collect payments from there. There was also a question about e-signatures as well. So we do have a couple of ways you can do that. You can include a signature field on a form. We also have a Jotform signed product, so that's more like a contract with a signature, a signature or signatures along the way. Both of those are available to you. If you are a Jotform subscriber, anything I talked about today is included in part of your plan. There are no fees to use any of these features. You'll see limitations based on the number of forms or signed documents or apps or whatever that you can create, but all of the features are available to you. Got a couple more. Let's see. Is it possible to enable HIPAA protection on forms for specific form fields? Yeah, so if you are a Jotform Enterprise user on a HIPAA server, you do have the option to, you can sort of check HIPAA features throughout that form, and you can toggle on whether each field is HIPAA protected. So yes, you absolutely can customize what information is or is not specifically HIPAA protected. Let's see what else. How does Jotform Enterprise protect patient data? Okay, that's a big question. Data is protected with 256-bit encryption. You have local data residency options. In Enterprise, you can use single sign-on. So that helps with keeping the signing process easy, but also keeping data safe. We have a number of other security features. If you would like to read about that more extensively, jotform.com/security will get you to the full scope of security features throughout our system. And can I share my email? Yes, absolutely. It's Morgan, Morgan at Jotform. And again, I'd be happy to hear from any of you with questions. If I can't answer your question, I would be happy to get you to the right person to answer it. I also would love to hear your stories and examples if any of you are already using Jotform and want to share what you're doing with it. The last thing I want to mention is, sorry, I'm just scanning the questions one more time. Yeah, the last thing I want to mention is that you will receive a link to this presentation either a little bit later today or early tomorrow. So as soon as the video is done processing, that goes out automatically. That will go to the email that you registered with. And if you click the button to view it, you'll see it in much the same experience that you see now. So all of the resources that are linked here will be available to you still. You can still reach out to our enterprise team, and you'll be able to watch the session in its entirety. I also want to mention we are planning to do more webinars throughout the rest of this year for the medical audience, so stay tuned for updates from us about that. And other than that, thank you all for joining me here today. I appreciate your time and your energy. And again, feel free to get in touch with me if there are any additional questions, anything you forgot today, anything you want to follow up on, and I would be happy to talk to you. All right, enjoy the rest of your day. Bye.